Appreciate everybody coming together to jump on. We have quite a few folks today, which I appreciate. So we restarted these last quarter or the last quarter, and then we'll be continuing these every quarter ongoing. So always want to make sure they're a valuable part of your time. So if afterwards you think, hey, this would be a really good topic for next quarter, please just send that. You can send that directly to myself or our licensing team, anybody at NFSU, and we will definitely get it added. Um, Thank you, Kathy, for the reminder. This is going to be recorded. So if anybody does not want to be recorded or their name, shows up, that please opportunity to drop off the call and have that available to watch at a later time on our page. So with that, we do have, as I mentioned, a pretty packed agenda today, and we'll do a brief introduction for folks presenting. So we have Kathy Elizondo and Kelsey Cookingham that will be presenting on complaint fry information. Uh, we'll also have Chris Statz, who is our licensing support staff, on today chatting about some forms. Sean Scott will give you some licensing reminders, who is also a licensing policy analyst, and Jeremiah Adams, also a licensing policy analyst, will be rounding out our meeting today. So with that, just a couple of reminders and general announcement. It is fire season, and folks who have already gotten a call probably are like, oh, okay, why is the state calling me today? We are taking a little maybe different approach in the past from the past, but anytime we're monitoring really closely for if your building is in a fire zone or an evacuation area. One of our team members, myself, our licensing analyst, or it might be somebody completely out of our unit, they will reach out to you, make sure things are going okay, see if you need anything, help us coordinate. But I really do want to make sure folks are aware if they're being impacted by fires to really kind of pay attention and know, is it safe to evacuate somewhere? Is it going to be safest to stay in place? And just, be prepared for one of us to reach out and talk with you. Also a reminder, the nursing facility cost reporting is due October 31st. As it's on the slide, you can refer to the link. So just those general announcements. And with that, I'm going to hand it over to our team to discuss the fry tips.
Thanks, Christy. Hey, everyone. Like Christy said, we just want to kind of briefly go over some fry tips just to kind of help you in your reporting of fries. So the first thing we want to remind everyone is make sure you're using the correct form. So you can see there's a link here. It should be an April 2023 date at the bottom of the form. That would indicate that's the most current form. You can also find it on the nursing facility licensing website. Second point here, please give as much information as possible. I do recognize that at times you're on a 2-hour window, but even within that 2 hours, I think you should be able to give enough description of the incident or some details. On the next slide, I'm going to share of kind of like what not to do. Be mindful that you only need to submit alleged violations of abuse, neglect, exploitation, or mistreatment, and this can include injuries of unknown origin. Please take allegations seriously. I mean, even if you feel the allegation's not credible, or you have a resident that has a history of making false allegations, we still want you to take them seriously and report them. Remember your time frame for submitting your investigations. You need to, at the date of the incident, you have 5 working days to submit your investigation to us. The point I really want to highlight here is we do have some facilities that do not submit their investigations timely. We are tracking that. And if we start to see a pattern, we are going to make that an allegation and come out as a complaint and investigate that. So really want you to be mindful to get those investigations to us timely. And then remember, your investigations need to be thorough, right? They need to include a detailed summary of what happened and your conclusion of why either you're ruling out abuse or neglect or not ruling it out. So we really want to see resident and staff interviews in those investigations. So I guess a quick example I can give here is saw investigation where a resident was alleging their CNA abused them. And the investigation did include an interview with the resident, which was great, but there were no.
I don't really have any updates since I saw you yesterday besides the consent stuff, and we possibly have an admit today.
I think, yeah, great. So the point I'm trying to make there is, although it's great, we do want you to interview the resident if they're able, but you also might want to interview other residents that this CNA may have taken care of, just to make sure there were no other residents affected. Next slide. So I kind of want, this is truly what we have gotten. So obviously this is incomplete. And again, I know at times you have a 2-hour window, but so you can see here, report of a resident on resident incident at 8 p.m. I'm sure it's pretty obvious that we would have liked to see more. So that resident and resident incident, was that physical, verbal, sexual? So this is where you really need to describe what happened. No physical injuries identified. Resident states she felt fine. Again, tell me what that means. She felt fine. You know, any observations where she just seemed to be her normal personality? No physical injuries identified. Was that a physical assessment that was done by a nurse, or, you know, what? And then residents were separated by staff. Again, good. I guess that's what we would expect, but we need a little bit more on how you plan to not only keep that resident, but other residents protected. So I just briefly wanted to kind of talk about that. When we have to triage an IJ priority for fries, there's a 3 or 7 day window that we're looking at. And again, I just want to highlight that we are going to triage it in 3 days if we do not see a really clear description of how you are going to protect that resident and all residents affected. So it's really important that you guys put that in there. Versus, so if we didn't see that in your fry, then likely we're going to be in there within 3 days. Versus if you go to the next slide, 7 days. And again, highlighting that you're showing that, yes, you've put in adequate protection for all residents, depending on what that allegation incident was. So I just kind of wanted to highlight that. It's really important that you put that stuff in there when we're trying to triage. So that's kind of a down and dirty. That was pretty fast. Do you guys have any questions? And I know Kelsey's on. Kelsey, if you think I missed something, let me know. Any questions, you guys?
Will we be able to get copies of the slides?
Yes, we'll be providing the copy of the slides. Yes.
Thank you so much.
Thanks, everyone.
All right, Chris.
Good morning. Technical difficulties here. This is Chris Stats, and I just wanted to reassure everyone that we are working really hard to get new forms and posters available to you. And we do have those available. You can reach out to me, or we can go through the form server website. You can download those brochures for yourself in-house, print them out there. We do send them, if you go to the next slide, they're available for you to request, filling this form out. And then you submit it by email. There's a little button to click to publications and distribution, and you can request a supply of brochures for your inventory. They come in packs of 50 for the brochures. And also with that, if you get a new complaint poster, it's the "Do you have a complaint" poster. Please make sure that they are posted around the facility where people can see them. And if you need them in another language, you can select that as well when you go into the forms website. We do know that accommodating our residents in their native language is preferable, and So we've made sure that they're translated into Vietnamese as well as Spanish and Russian. And if you need them in any other format, please reach out to us and let us know. And as always, if you have any questions, you can reach out to me directly at chrisstats@odhs.oregon.gov, and I'm happy to help you.
Thank you, Chris. And next up is Sean.
Hey everybody, just wanted to give a reminder out there that the quarter 2 2024 CNA staffing reports are due by the end of the day on July 31st. So if not already sent those in, please get those in. Also, we have noticed a growing trend of having trouble getting a hold of nursing facilities. For some nursing facilities, we'll call and it will just ring and no one will answer. For other times, it'll go to an answering service, and either the administrator will have the old administrator on record for their voicemail, or their voicemail will be full. So it's getting hard to get in touch with people in a timely manner, and that's difficult just for normal business reasons, but also because as Christy has already mentioned, during the fire season, we'll be trying to get a hold of you all to find out what's going on with your facility during the fire season, and it is important that we get in touch with you. So please make sure that your voicemails are up to date and that there is someone manning the phone line so we are able to contact you.
Thank you, Sean. All right, Jeremiah, excuse me.
Thanks, Christy. Hi, everybody. My name is Jeremiah. I'm one of the policy analysts with the Nursing Facility Licensing team, and I am going to talk about some legislation that was passed in 2023 and some new administrative rules that are in effect, and a new training that is going to be required for staff by the end of this year. So there's a new LGBTQIA2S+ administrative rules and mandatory training. In 2023, the legislative session, Senate Bill 99 was passed, creating a Bill of Rights for long-term care residents in Oregon who identify as LGBTQIA2S+ or live with HIV. Senate Bill 99 also included a new mandatory training for all long-term care setting administrators, facility staff, and contractors, specific contractors, providing care in Oregon, licensed long-term care settings. So these new mandatory trainings have gone into effect for all nursing facilities, all residential care, assisted living, and adult foster homes. All staff of, can you go back one real quick? So all staff of APD licensed long-term care settings are required to take the training by December 31st, 2024. So you'll have a few months. Thank you. Go ahead and do the next. Appreciate it. So training certificates are going to be valid for 24 months from the date of completion. Additional training will be required every 2 years. So this is the legislation that was passed. It's a biannual training, so every 2 years, which is a lot different from other trainings. So I know it's going to be a little bit difficult to keep track, but that's going to be important. A certificate of training of completion is transferable between care settings as well as facilities. So if a staff member goes to another facility, they should be able to use that and not have to retake the training again until their 2-year mark. New staff with the start date of January 1, 2025 or later must complete the training before providing care. When is the training available? So I just verified last week that the training is to go online August 1st. So in just about a week, the training will be available to everyone. So you have about 4 months to get everyone trained. The training, again, August 1st. The training will be available in Spanish, hopefully November 1st, 2024. This training is necessary to ensure that all staff are equipped to provide safe, respectful, and inclusive care for LGBTQIA2S+ residents and those living with HIV as mandated by Senate Bill 99. The training is approximately an hour and a half long. Obviously, it could probably be completed a little quicker or take a little more time depending on the person. Do providers need to keep training records? Yes, this is required training, and providers must retain all training records and be prepared to provide proof of completion to relevant department staff upon request. Where can I get the training? So APD, Department of Human Services, has been working closely with Oregon Care Partners to develop the online training, which is the most accessible and convenient option at this time. After this initial training, facilities or companies are going to be able to try and develop their own trainings, and they would request approval through DHS. Who is required to take the training? All facility administrators and staff working in long-term care facilities, including kitchen staff, housekeeping, direct care providers, as well as certain contractors working in these settings. And these are some of the topics that are going to be covered in the LGBTQIA2S+ training. Understanding the terminology, there is 18 new definitions in Administrative Rule 411-085-005. So it's important to take a look at those. It's also going to be part of this mandatory training. LGBTQIA2S+ history in the US and Oregon. Best practices for communicating with residents and residents living with HIV, understanding health and social challenges for those residents, and creating a safe and affirming environment. So there was also, along with Senate Bill 99, it created some additional administrative rule changes, and I'm going to talk about, they're not on slides, but I'm going to talk about those right now, and I'm going to give you those specific rule numbers so you can take a look at those for yourself. So I just talked about, there's 18 new definitions in the definitions section, and those will be discussed in the mandatory training, but it would be also advantageous to take a look at those as yourself, for yourself as well. There's new required postings for nursing facilities, and that's in 411-085-0030. There's 2 new required postings due to this new due to Senate Bill 99, which created these new administrative rules. So take a look in that section as well. There are new LGBTQIA2S+ protections, and those are listed in 411-085-0310, number 21, little a through L. So there's quite a few new protections listed there. There were also some additions to another rule set. So 411-086-0040 for admission of residents. So there's some new requirements in that section for admitting new residents, new questions to ask and to include in your admission documents. There were also additions to that same rule set, 411-086-0060, under the Comprehensive Assessment and Care Plan. So take a look at that section as well. And all of the new training requirements for employees and for contractors are going to be listed in, they're actually already listed. The rules are actually in place already, and you can find those if you take a look at the Secretary of State's website. And those are in 411-086-0310. So that's under employee orientation and in-service training section. And again, those include the training requirements for staff and for the applicable contractors. There are some contractors that are not going to be required to complete this training, and that would include landscaping staff, delivery staff, those type of folks. So not all contractors will be required to take the training. It's the contractors that are going to have direct interaction with the residents. Just to let you know, also, there is going to be a provider alert with frequently asked questions and links to access this new training. And that, I believe, is going to go out today or tomorrow. So keep an eye out for a new provider alert. That's going to answer a lot of questions for you. You might have a question, can you do a group training? Yes, you can do a group training to meet this requirement, and that information will be in the frequently asked questions section of the provider alert that's due to go out today or tomorrow. I think that is it.
Thank you, Jeremiah. And then we have question in the chat. Is there a link for the mandatory postings that we need up in the buildings? So I believe, Kathy, do you? Oh, there's a question. Is there a link for the mandatory postings that we need up in the building? Do you know if that covered in the link Kathy provided above?
I don't think so. I can. It's 411-085-0030, and there's two new required postings. Let me see if I can give the exact rule number.
Sorry, 411-085-0030.
Correct. And there's two new postings. Let me take a look and I can give the exact rule number here in 1 second.
Maybe I just put it on the brain. Sorry, guys.
Perfect. Thank you. So the two new required postings are 411-085-0030, number 1, big F, and big G. So 411-085-0030, number 1, big F, and big G are the two new required postings in that area, in that section.
Thank you. A question from Eugenia. Can providers incorporate the required language into existing non-discrimination postings?
Sorry, I was on mute. I believe so, just as long as the required information is included. I think it's fairly clear. One of the postings is a set language where all the facility has to do is put the name of their facility, and the rest of the language is already spelled out. So that would probably be easy to post by itself. But the other posting, which talks about the non-discrimination policy, I think that would, you could include that with other postings as long as all of the information is listed there. And the posting states, as described in 411-085-0210, number 1, little w. So as long as all of that information is included. And the other posting talks about 411-085-0310-21. So as long as all of the information is included, I think that you should meet the requirements. I don't think there's any requirement that they have to be posted separately.
Any other questions about this topic? Okay, with that, well, we got through it a little bit quicker than anticipated, but with that, we want to make sure there's always room for question and answer time. So please, if you want to drop a question, if you have it into chat, or as Kathy put it on here, there's always the option to drop it into licensing and we'll circle back and answer any questions. But please, if you have any questions, just drop it in chat or come off mic or come on to the mic and just ask, and we'll try to do our best to try to get an answer for you. Wow, with quiet, I will take that as a.
Hold up, Christy.
Oh, ready. All right, so question in chat. The Fry forum conversation stated only report abuse and neglect, etc. This is as opposed to what? What other things were people reporting that were not needed? Kathy, do you want to, Kathy E, do you want to take that one?
Yeah, I think one example I think I've seen a few times, sometimes we'll see med errors, and I would question you, like if there's a medication error, not good, we get it, but they'll put neglect. And so I would, for me, again, that would fall into 24-hour. And, unless you have a staff member saying, yeah, I knew I wasn't supposed to do give him, I knew I was supposed to give him this, but I decided to give him this. I decided to double dose him for whatever reason, was that a bad thing? Or, that necessarily wouldn't be reported, right? Because it's not neglect. And if you did have a staff member that willfully and deliberately gave a medication, because they weren't paying attention or just didn't feel like, delivering care and services accordingly, then that's one thing. But just sending a simple med error or even a med error that, may resulted in something, I would say doesn't need to be reported unless it meets the definition in that FRI form of abuse and neglect or mistreatment. That's the one I kind of see sometimes, and I'm like, did you need to submit this? Christy, can you think of something else, or Kelsey?
Similarly too, there's the falls with injury. Oh, sorry, Christy, I didn't mean to.
No,
yeah, that's
Kelsey, take it away.
Common.
That's where my mind went immediately.
Yeah, so falls with injury where, for example, we've seen ones where the resident's alert and oriented and they say, I got up, self-transferred, fell, and they sustained, even if it's a fracture, that doesn't need to be reported unless there's that potential, it meets that definition of neglect, like the CNA failed to follow the care plan, self-transferred them with one staff when the resident's care planned for 2. That would be something where you'd want to report that, but not every fall, even not every fall with injury needs to be reported.
Thank you, Kelsey. Yeah, and then, in your investigation, you might find that, that CNA just, for whatever reason, just got overwhelmed and forgot. And, again, it wasn't that deliberate willful, but, you can show that through your investigation, especially witness falls too. If you see someone fell, it looked like everything was fine. It's just an accident. We get that can happen, but hopefully that answers your question. If not, let us know.
Any additional questions?
Christy, this is Jeremiah. I just wanted to throw out to facilities that might be listening. Recently, NIF licensing has done transfer, right of return, right of readmission trainings for a couple different companies. And so if there's any facilities or other corporations or companies that would like a training about involuntary notice of transfers, right of return, right of readmission, we can do it for several administrators, admission staff, whoever you would like included. Just let us know and we can set that up with you.
Thanks, Jeremiah. Kathy or Horace?
Oh, hi. I just wanted to let everyone know that in the October news hour, we will send out a reminder through the Gov Delivery Provider Alert process in order to try to expand awareness in advance. So we will be tickling our calendar to send this out multiple ways, not just email. That way we can capture more interested parties and there won't be such a scramble. I noticed that CDC does that. So just a heads up that you'll be getting notified multiple ways about the October news hour and others going forward.
Thank you, Kathy. Yeah, we'll just wait for a little bit. I know sometimes I don't see the chat feature anymore. It doesn't show me typing anymore. So I'll give it, if there's just a minute to see if there's any other questions. And it looks like Jeremiah, I'm guessing Avamere Junction City is saying yes to sign us up for training. I think that's what is meant.
Okay, I think that was Damien. And yeah, I can reach, I'll reach out to you, Damien, and if Avamere would like, we could do the training for, you know, all Avamere administrators, and who else would like to attend, or just specifically for you and your team. So I'll reach out to you.
Thank you.
There's nothing additional. We will not keep you to just keep you. You can always reach out to us. We're always open to answer questions and clarification. Obviously within our ability in the regulatory kind of environment, that's, you know, how we go. But we do have an open door and want to make sure that we're providing the most assistance we can to provide the best outcomes for our residents. So with that, I hope everybody has a great day and weekend, and thank you so much for joining us. Again, as Cassie mentioned, we're going to be blasting out this a little bit differently in the future. If there's any other topics that you really want to discuss next go round, please just send that to us and we'll make sure it gets added to the agenda. So thank you.
Thank you. Thanks, Christy.
Thanks, everybody.
Thanks.
Bye.
Thank you.